Hello everyone! Magandang hapon po. Ako po si Anshe mula sa CARE. Welcome po to the first Real Hub Resilience Knowledge Learning Exchange Series. At maraming salamat po sa inyong oras sa pagsama nyo sa atin ngayong hapon. This afternoon po, we are very excited to hear from our speakers from the Department of Health, from the cities of Marikina and Malabon, and the United Architects of the Philippines. Emergency Architects. Before we start, I would like to introduce, ako po si Anshe Talavera mula sa CARE Philippines at ako po ang inyong magiging moderator para dito sa ating Resilience Knowledge Exchange Series, specifically para po dito sa ating first session, From Design to Deployment, Gaps, Challenges, and Opportunities in Setting Up Community Quarantine Facilities. Para po maumpisahan ang ating session, let us hear a brief message from the Country Director of CARE Philippines, Mr. David Gazashvili. Hi, David. Good afternoon.
Hi, everyone. Thank you very much for joining the webinar. I would like to say a couple of words about CARE and a couple of words about the Resilience and Innovation Learning Hub that we set up in the Philippines. And many of you know that CARE, or Cooperative for Assistance and Relief Everywhere, is a major international humanitarian agency delivering emergency relief and long-term international development projects. It was founded in 1945, and CARE is a non-sectarian, impartial, and non-governmental organization. CARE works in over 90 countries, supporting over 960 poverty-fighting projects and humanitarian aid projects, and is reaching over 80 million people on an annual basis. In the Philippines, CARE has been working since 1949. Many of you may remember that CARE was supporting the government of the Philippines with school feeding programs like Nutriban and milk distribution in the schools. Now CARE is focused on supporting the communities to prepare to natural disasters as well as human-induced crisis, as well as to help people to deal with the crisis and recover after the crisis. So we have projects throughout the Philippines focused on resilience, focused on livelihoods recovery, focused on health programs, and we're working in the Philippines, we're working in partnership with many national organizations and local organizations. Some of them are the co-founders of the Resilience and Innovation Hub. The Resilience and Innovation Hub is a joint initiative of CARE Philippines and Netherlands. And as I said already, it is carried out in partnership with Assistance and Cooperation for Community Resilience and Development Incorporated Accord, with Agri-Aqua Development Coalition Mindanao and Citizens Disaster Response Center. So these organizations continue to collaborate for the continuous implementation of the Real Hub webinar series and other activities. So with that, again, welcome everyone to the webinar, and I will hand over back to Anshe for the continuation of the webinar. Thank you.
Thank you, David. Thank you for joining us this afternoon. To add more few information on what our Real Hub is all about, I would like to call on now Yowie Gonzalez, Project Manager of the Partners for Resilience Project. Yes, go ahead, Yowie.
Hello, everyone. Thank you so much for joining us this afternoon. So this is the first ever Real Hub webinar. And Real Hub is, as mentioned by David, the Resilience and Innovation Learning Hub Philippines. So we are a platform for learning and reflection and source of knowledge in disaster risk reduction, climate change adaptation, ecosystem management, and restoration and innovations. Real Hub further develops and integrates the IRM approach, or integrated risk management, to combine DRR, CCA, EMR, across all sectors of Philippine society. So as mentioned by David, we are at the moment composed of 4 organizations: CARE, Accord, CDRC, and AADC, but we welcome all kinds of institutions. If you have research and innovations related to resilience, please give us a message, and we're willing to collaborate and hopefully develop more knowledge products that everyone that's working in integrated risk management can use, especially for our local government units. So please like our Facebook page and also visit our website, realhub.org, for more resilience-related resources. And don't forget to get in touch with us if you want to collaborate with us. So that's all, Ansha. Thank you so much.
Thank you so much, Yogi. Okay, so we move on with our session. Let us take a look at the program. So we take 2 steps back to the previous slide. There, here we have. Ito po yung ating program for this afternoon. First, we would do a very quick overview of the objectives and ano rin po yung mga lumabas na expectations ng ating mga participants today on the webinar. We will have 4 presentations. First up, we have from the Department of Health, followed by City of Marikina, and then City of Malabon, and the United Architects of the Philippines Emergency Architect. Pagkatapos po nito, we will have time for question and answer, and magkakaroon din po tayo ng message from our reactors from among our audience din today. Before we end, we would also like to get your feedback, how you find the webinar and how we can improve, and after that, we'll do a quick wrap up and overview po nung next natin na na learning exchange seminar, and then we will have our very brief closing. Balikan lang po natin ng konti ano yung overview o bakit ba natin sinasagawa itong ating webinar on community quarantine facilities. So yun po I'm sure lahat tayo ay pinabantayan at very active doon sa pag-update kung ano na yung kalagayan ng ating bansa in related to patients with COVID-19, and more nakikita po natin gaano kaimportante na mas ma-equip yung mga local governments, yung mga communities with quarantine facilities or temporary treatment facilities to make sure na yung ating mga possible na mga patients will have safe and will have equipped facilities to take care of them. Largely, yun po yung ating i-discuss this afternoon. What is the importance and what are the technical information that we need in terms of establishing quarantine facilities. We would be sharing practices and practical tips and lessons from experiences. At ayun po, ito rin yung lumabas dun sa mga expectations natin. So the session po natin this afternoon will be a combination of the policies, of guidelines from DOH, at paano naman na gagawa nun, sa paano na isa praktika, ano yung mga practical experiences ng ating mga speakers din sa pag-establish nitong mga CQF. Ilan din po dun sa mga nabanggit na expectation ay ano yung mga practical designing, planning and building strategies, including site selection, what are the cost-effective solutions, what are the standards, at ano yung mga challenges, gaps, and opportunities that we are presented with this endeavor. At isa din po na very interesting natin na makita ay how do we link itong ating mga initiatives or related to this pandemic doon sa longer term naman na resilience building in terms of disaster preparedness, disaster risk reduction, and longer term resilience building. So yun po, makikita din natin later on how these are linked and how they are reinforcing each other. So yun po, gusto rin nating makita dahil sa ngayon mounting yung maraming needs, maraming gaps, at syempre given the circumstances we are in, while we have these challenges and these gaps, we of course would want to to answer to the needs of our of the population, of the people. And with this, gusto po natin ding tingnan ano ba yung good enough, given the circumstances, given the resources that we are with. Ano yung good enough natin na na quality facilities that we can provide for the people. At so yan po, largely dyan po iikot ang ating discussion this afternoon. Bago pala po yung house rules, gusto muna nating silipin kung sino po yung mga agencies, organizations na nakapag-register po dito sa atin. So, yun po. Quick roll call of participants. Karamihan po, I think, ay nandito na nakapasok na. Pero yung iba ay baka po nagla-login pa. So, ito po. So, combination po tayo ngayon ng mga local government units, subnational and national government agencies. Meron din po tayo mga kasama from the academe, from private foundations, from private corporations. Meron din po tayong mga local and international non-government organizations. Sige po. Meron lang pong ilan sa ating mga registrants na hindi nakapag-indicate ng kanilang affiliation. So kung hindi po kayo nakalagay dito sa ating roll call of participants, do send us a message para po ma-note natin kung sino-sino yung mga kasama natin ngayong hapon. As we proceed, gusto lang po nating ipakilala very quickly. Yun pong ating magiging presenters doon sa 4 na presentations na mayroon po tayo sa ngayon. Ito po yung ating mga speakers for the first presentation. We will have Dr. Terence John Antonio from the Department of Health, Health Facility Development Bureau. And he is joining also with us dito po sa ating session is Ms. Joy Padricano, also from the Department of Health. The second presentation po, we will have Dr. Christopher Guevara, Coordinator of City Epidemiology and Surveillance Unit of the Marikina Health Office. And then after sharing on the Marikina experience, we will have Architect Jose Miranda from the UAP Emergency Architects. And for our final presentation, we will have Sir Arnel Mendoza from the Malabon City DRMO and Dr. Mitzi Tanchoco, the Director of the Hospital ng Malabon. Susunod na session, ito na po yung ating first presentation for the afternoon. Ang una po nating speaker ay mula sa Health Facility Development Bureau ng Department of Health. We have Ms. Joy Padricano with us. She's the Development Management Officer 4. And for our first speaker para po sa presentation, we have Dr. Terence John M. Antonio. Dr. Antonio graduated with a medical degree and a master's degree in business administration from the Ateneo School of Medicine and Public Health in 2016. He has worked in the government for 3.5 years. Initially, he was with the province of Northern Samar as a medical officer in Northern Samar Provincial Hospital as a frontliner and also providing technical assistance to the hospital operations and supply chain management for medicines and medical supplies of the province. After that, for more than 1.5 years now, he has transferred to the Department of Health Central Office as a technical staff for Integrated People-Centered Care and Emergency Department Manual of Standard. Yun po, let us all welcome Dr. Terence John M. Antonio, a Medical Officer 4 from the Health Facility Development Bureau of the Department of Health. So I now turn it over to you, Dr. Antonio.
So, good afternoon po ulit. No? Again, I'm Dr. Terence John M. Antonio, and I would like to thank this organization po for inviting the Department of Health and allowing us to share the different policies written by the department, particularly on the temporary treatment and monitoring facilities. So, today I will be joined by Ms. Joy Padricano, staff of our Infection Prevention and Control Program of the Health Facility Development Bureau. So today, I will be discussing the role of the temporary treatment and monitoring facilities in the healthcare provider. For the objective of this presentation, we're going to discuss the role of the temporary treatment and monitoring facilities, or TTMFs, in the provision of COVID-19 related care in the healthcare provider network. We're going to discuss the developmental standards for the temporary treatment and monitoring facilities, or TTMFs, based on existing guidelines of the Department of Health. I'll be inserting also some of the operational guidelines as well based on existing issuances already. Just a quick rundown of the different references for this particular presentation. You may access the following issuances on the given link dun sa right side or dun sa rightmost column po. So you can access them for your guidance later on. So mainly, the reference for this is the Joint Administrative Order between DILG and DOH on the guidelines on local isolation and general treatment areas for COVID-19 cases or ligtas COVID, and the Department Memorandum Number 2020-0123, or the interim guidelines on the management of surge capacity to the conversion of public spaces to operate as temporary treatment and monitoring facilities for the management of suspect and probable and mild cases of COVID-19. To start the discussion and to fully understand the role and function of these facilities, it's important first to discuss how COVID-19 related care is delivered through the healthcare provider network. So this diagram is based on the Department Memorandum Number 2020-0178 or the interim guidelines on the healthcare provider network during the COVID-19 pandemic. So based on this issuance, the local government unit are to establish a province-wide and city-wide healthcare provider network composing of the different types of facilities with different roles to play. Likewise, this issuance describes a patient pathway for both COVID-19 and non-COVID-19 cases. In a healthcare provider network, contact tracing through the BHERT or the telemedicine can be the first contact of care. This first contact shall refer the patient to the primary care facility, who in turn will refer or navigate the patient to the proper facility depending on the severity and symptoms or the context of the patient. So, depende po sa kanyang symptoms, if they're mild, symptomatic, they will be referred to either home isolation or quarantine or these temporary treatment and monitoring facilities. Zeroing in to the role of the temporary treatment and monitoring facilities, so these facilities are intended to cater to close contacts, suspect, probable, and confirmed COVID-19 cases with mild symptoms, age 18 to 59 without comorbidities. These facilities may also serve as a step-down facility. So kung babalikan po natin po yung diagram kanina, these temporary treatment and monitoring facilities may serve as a step-down care in a healthcare provider network. Also, based on the Joint Administrative Order number 2020-0001, there should be a separate facility for close contact, suspect and probable, and confirmed COVID-19 cases. These facilities are expected to provide the following services: so supportive treatment and psychosocial services, outpatient services for patients with respiratory symptoms, given that it may serve as an extension of the rural health units or the urban health centers po, no? So, but an optional service. Basic room and board, and as well as timely referral in cases where patients develop or progressed with their symptoms. LGU-led TTMFs, or also known as the Ligtas COVID Centers po, are community-managed facilities within a barangay, municipality, or city or province. These are LGU-run facilities managed under their incident command system, and the provincial government serves as the lead in terms of this IECS, and each TTMF is represented by the mayor or his designated representative. Particularly for the NCR po, no? So sa National Capital Region, meron po tayong mga tinatawag na mega TTMFs or yung mga national government-led TTMFs that serves to augment or supplement the LGU-led TTMF in the provision of services. So this is headed by the National Incident Command Emergency Operations Center, and it is currently engaging the different stakeholders for the provision of care. Now we're going to the different consideration in terms of the standards already po. So based dun sa issuance natin. In terms of considerations for location, so the temporary treatment and monitoring facility should be accessible or should have access to a level 2 and level 3 facility catering to COVID-19 cases. It should be a pre-identified health facility for referral in cases where patients develop or progressed with their symptoms. It shall provide uninterrupted access to electricity and uninterrupted potable water supply. The facility should also be connected to a sewer line, and if this is not possible, wastewater should be collected regularly. So examples of these areas are open spaces, gymnasium, auditoriums, hotels, or even dock ships po. So depende po dun sa availability dun sa isang local government unit. In terms of engineering controls po, no, the facility should be divided or should follow the zoning for this particular facilities. It should follow the zone for contaminated, a buffer, and sterile zone. So the contaminated zones serve as an area where patients are admitted and contained. Buffer zones serve as a donning and doffing for PPEs for the healthcare workers. And the sterile zone serve as a holding area and entrance of the healthcare workers. Depende po din sa laki po ng temporary facilities, these sterile zones, nandun din po yung nakalagay mga supplies if ever. A separate entrance and exit for patients should be present, as well as for the healthcare workers. It should follow a unidirectional foot traffic and shall provide adequate ventilation. It should also follow the ratio standards for both toilet and bath. Mas detailed po ito dun sa mga issuance na nabanggit po kanina. And as mentioned, a continuous water supply. So this is an illustration of the zoning looks like. So on the right side of the screen, nandito po yung sterile zone. And this is the prescribed buffer zone po, no? And dun sa left side po yung contaminated zone. So makikita po natin yung buffer zone is divided into 3 levels o may tiering na nagaganap po. So based on the recommendation po kasi, when this is leveled, mas lesser yung chance of break in IPC protocols po or IPC procedures. The donning area for the level 1, it serves as a changing from outside clothes to uniform. Level 2 for hand hygiene, and level 3 for wearing of the complete PPE. Doon naman po sa other side, for the docking area, yung sa level 1 po niya, removal and disposal of gloves and gown. Level 2 is hand hygiene, removal of mask and goggles. And lastly, yung changing back from uniform to outside clothes. This can also be accessed dun sa a more detailed listing of the engineering controls can be found on the link provided in the screen dun sa bit.ly DC 2020-0219. Marami na po kasing policies na naisulat about temporary treatment and monitoring facilities. So the checklist provides us a summary for all of those standards po, no? So for easy access. In terms of patient placement, for facilities catering to confirmed COVID-19 patients, cohorting may be allowed, so a ward type arrangement can be done, provided that there is a partition separating to ensure privacy. For facilities catering to suspect and probable COVID-19 patients, to uphold yung IPC po natin, individual rooms with own toilet and bath is the ideal arrangement. Cohorting of suspect and probable is not allowed, and in extreme cases where toilet and bath will be shared, stringent disinfection procedure should be in place, or disinfection after every use po ang gagawin. For facilities catering to close contact, it should have the same arrangement or same treatment as those suspect and probable COVID-19 patients. In terms of facility management, facility manager shall be assigned to ensure the smooth operation of the entire facility. The facility manager shall ensure that the facility runs and functions 24/7. Necessary basic needs such as food and water, human resource, medicines, and medical supplies are available, and availability of at least a level 1 BLS ambulance as classified in AO 2018-0001. Previously mentioned po, no, that temporary treatment and monitoring facility or TTMF shall have a pre-identified health facility for transfer in cases that COVID-19 patients develop severe symptoms during the course of their admission in these temporary facilities. In terms of human resource, ito po yung mga kinakailangan at na-identify po based po dun sa ating issuances. A facility manager, facility physician, nurse and nursing aide, barangay health worker, a data manager, security officer, and sanitary officers. In terms of human resource management also, it is expected that a pre-deployment orientation shall be conducted to ensure that our health workers are oriented on the facility protocols, management of patient, IPC-specific protocols such as proper donning and doffing. In cases of breach in protocol for IPC, kailangan directed po sila. The following issuance also provides guidance in terms of risk assessment and management of staff based on the World Health Organization. At the same time, we've also summarized pertinent IPC protocols needed for these facilities through the Department Memorandum Number 2020-0225. For the healthcare workers specifically, the use of IPC checklists for healthcare worker readiness. More on human resource management in terms of provision of accommodation and transportation arrangement and food, guided by Department Memorandum Number 2020-0162 and DC 2020-0145. Duty schedule should follow the CSE rules and the Department Memorandum 2020-0153. Testing for healthcare workers is guided by DM 2020-0258. The facility, as mentioned, should be able to provide medicines and medical supply for supportive treatment, equipment for monitoring, and adequate and rational use of PPE. In terms of medical record keeping for patients, the following documentation should be done or conducted: pre-admission, during admission, and post. So prior, an informed consent, a registration of patients in a master list, and creation of patient health record. During the admission, doctor orders and progress notes, nurses notes, and monitoring sheets should be basically all the care that is provided should be documented. And upon discharge, home instructions and follow-up and other reminders. So the health record upon patient discharge shall be endorsed or forwarded to the urban health centers or rural health unit where the patient is assigned. You may also access copies of the forms through the link provided below. A data manager, so part po nung issuance po is in terms of reporting. A data manager and encoder shall ensure consolidated and complete contact and suspect, probable and confirmed case profiles and be updated regularly. And actually, the TTMF should be registered po, no? The specific instructions can be found in the link provided. So yung bit.ly/DDC tracker guide. Nandun po yung step-by-step guide on how you register dun sa tracker po so that we can monitor kung ilan po yung patients and availability of beds in all TTMFs. In terms of coordination, as mentioned, in cases where patients whose symptoms progress shall be referred to the appropriate facility, the attending physician from the TTMF shall accomplish the necessary documents for the referral of patient. The designated personnel shall contact or coordinate the referral to the identified L2 or L3 or a COVID-19 referral hospital, and the transportation shall be provided by the referring facility. TTMFs can serve as a step-down care. From patients from hospitals can actually refer patients to the TTMF in cases that they're just completing, so resolve na kanilang symptoms or they recovered clinically but are waiting for the completion of their 14-day quarantine or isolation or waiting for at least one repeat test. So criteria for discharge is guided by the Department Memorandum 2020-0229 and Department Memorandum number 2020-0258. The patient should have a complete resolution of symptoms, completed the 14-day quarantine, and at least one negative RT-PCR. For the specific details po na per population, you can refer to DM 2020-0229 for guidance. Other issuances related to TTMFs, I'm also providing a copy of the different issuances related to the operations naman po of the temporary treatment and monitoring facilities. Hopefully, this serves as an avenue for everyone to get to know or to have access to these issuances. You may also email us through the doh.hfdb.od@gmail.com po for any technical assistance needed or clarifications about these issuances. So, thank you very much.
Thank you po, Doc, for providing yung summary ng mga issuances and mga policies that the different stakeholders need to understand, they need to know about if they would be establishing temporary treatment facilities or quarantine facilities. So yun po, yan yung overview ng in terms of policies and in terms of guidelines. Ngayon naman po, for the rest of the afternoon, yung ating mga presentations will look into actual experiences of local government units and our technical organizations. Para naman po sa ating susunod na presentation, ano naman po ito, no? Experience naman ng Marikina City. Kasama po natin ngayon si Dr. Christopher Guevara, ang coordinator ng City Epidemiology and Surveillance Unit ng Marikina City Health Office. Let's give a warm welcome to Dr. Christopher Guevara. So, Doc, I turn over to you.
Good afternoon, everybody, and thank you, Ma'am Anchi. Sa present slide, nakita nyo, here is the current data of the COVID-19 cases of Marikina City. Actually, hindi na siya current kasi this is as of yesterday. So as of yesterday, the city has a total of 316. Pero right now, we have 316 confirmed cases, of which 136 yung ating active cases. Pero as of 4 o'clock today, meron na kaming 325 active cases, 325 confirmed cases, 138 active cases. Yung patient recovered as of yesterday was 150, today is 157. So meron kaming additional 7 recoveries today. The number of deaths remain the same at 30. Regarding recoveries naman, while the DOH has eased up on the definition of recoveries, the city has maintained that a confirmed case needs to have 2 negative swab results to be considered as having recovered from the virus. The city can afford to do this. Pwede kami mag-stick kasi we have our own molecular laboratory. Marikina has been able to control the increase in the number of cases of COVID-19 in the city. Most, if not all cases, are in home quarantine or isolation. Rapid contact tracing of all close contacts were done to ensure transmission is brought to a minimum. Targeted testing of all qualified cases were also done to appropriately manage and refer cases. So how did the city manage the pandemic? So I will cite to you several initiatives that were undertaken, which will eventually lead to the construction of our emergency quarantine facility. Firstly, the census was established as a separate unit. Prior to the pandemic, the city has no census, so wala kaming office before. We only had a surveillance officer and a surveillance nurse who are also part of the technical office. When the pandemic hit, a new surveillance officer was designated, that's me. The surveillance nurse was put in charge of our swabbing team, ibang office niya. Then the swabbing team is composed mainly of volunteer PNP for personnel. Within our ranks, wala kami kasing mga capable na swabbers. Buti na lang may mga police, yung PNP, na nag-volunteer to be members of our swabbing team. The other members of the CESU, which consist mainly of the HRH from the DOH, sa ngayon, tatatlo lang aming organic personnel. The rest are from the DOH with a total namin personnel ngayon 17 personnel and 12 swabbers. Yun ang unang ginawa namin. Nayos namin yung aming surveillance unit. After building up our CESU, nag-develop naman kami ng system or program para sa pasyente namin. Dito, ini-encode namin yung aming mga patients. Although this program is still not 100% complete, it is already functional and the city is already using it now. Ano advantage having this system? Dito sa system na to, napansin kasi namin habang dumadami yung pasyente, mas mahirap i-monitor yung ating mga patients. Hindi namin ma-follow yung kanilang swabbing schedule, how many times they have been swabbed, whether they are still confined or already at home. Sa system na to kasi, makikita namin mas madali. So alam na namin kung beses silang na-swab, kailan sila isa-swab, madideclare na ba namin silang recovered. So mas easier sa system na to. So dito sa makita sa screen, naka-blackout na yung mga names, pero makita natin yung status nila, na naka-home quarantine pang iba, yung iba considers PUMs, tapos meron kaming ID system, tapos yung kanilang barangays. Then lahat ng ito ay pwede namin i-edit naman. So kasama sa system na yon, meron kaming spot mapping. So dito makita nyo, isa satellite map of Marikina City. Naka-incorporate ito doon sa aming system and this is regularly updated so we can visually verify the residences of our confirmed cases and their close contacts. So makita nyo, may mga colors to. So makita natin na yung kulay red ay mga admitted patients, yung mga orange, yung mga quarantine patients, yung mga blue, ito yung mga recovered patients na namin. Then yung black, ito yung mga deaths namin. Kung i-zoom natin yung mga dots na yon, makikita natin yung ganito, May yung dot na blue still ito yung mga recovered patient, then makita kayong red na circle, Ang nangyayari diyan, kunwari nag-hover tayo doon sa isang dot, makikita natin yung information ng patient. So, when you hover over in the map, you will see the details of the patient. And within the red circle, ito yung 20-meter radius na ni-require ng aming city mayor para mag-expanded contact tracing kami. So, lahat ng resident living within the 20-meter radius ay aming ini-screen via rapid testing. So, ina-identify namin lahat ng mga taong nandun for rapid testing. So, most essential among the initiatives is the construction of the Marikina Molecular Diagnostic Laboratory. So, this is the country's 20th accredited COVID-19 testing center. And the lab will be part of Marikina's regular health service, as the virus is likely to remain in the country even when the number of infections subside. Mananatili ito kahit wala na yung pandemic. Then, this laboratory was built in collaboration with Manila Health Tech Incorporated, which is a private research and development company with the diagnostic pipeline and a pioneer spin-off from the UP. And this COVID laboratory enabled the city to freely schedule its constituents for swabbing. Unlike before, when we were sending our specimen to assigned laboratories like RITM and LCP. At present, we can now run up to 300 tests daily, which greatly enhance our management of confirmed and suspected cases. Ito yung nakatulong kung bakit kami can afford na humingi ng 2 negative swab test para kami mag-declare ng isang recovered case. So ito yung picture ng Marikina Hotel and Convention Center. At the onset of the pandemic kasi, our priority was to swab only confirmed cases kasi nga wala pa kaming laboratory noon. So limited kami ng aming isa swab lang yung mga confirmed case. And ang swabber namin doon galing lang sa DOH. Kasi yung aming previous swabbers, lahat na COVID na noon. Na-quarantine sila, so dumating time, wala kaming swabber. Nanghirap kami sa DOH. Yun ang aming priority before. Nung nagkaroon kami ng laboratory, nagkaroon na rin kami ngayon ng necessity to put up swabbing teams and swabbing sites. Now, bukod sa mga confirmed cases, nagsaswab na rin kami ng close contacts, highly susceptible indeed individuals and others like yung mga pregnant women na malapit na mga anak, so sinasama namin sila for swabbing. Yung mga patients who will undergo surgery, sinaswab din namin yon. Then, the Marikina Hotel was used primarily as a quarantine facility for exposed health workers. So before, kung wala pa kami swabbing team, dito lang tino-quarantine yung mga example, yung mga workers na Mang Rodriguez na na-expose sa positive, dito sila kina-quarantine hanggang maka-recover sila. So, pero hindi sila yung mga COVID confirmed cases, mga exposed lang. So, it also became quarantine facility for our swabbers. So, nung nagkaroon kami ng swabbers, dito namin sila hina-house habang nagjo-duty sila. Then eventually, naging quarantine facility na rin siya for our OFWs. So at present, isa siyang accredited quarantine facility for OFWs. So aside from being a quarantine facility, the hotel is also being used as our swabbing center. So dito, dinadala namin yung pasyente na mga yung mga close contacts, yung mga other people needing swabbing, dito namin sila sinaswab. Para siyang mega swabbing center, pero kinikater lang namin dito yung aming mga constituents. Tapos, naging importante kasi ito dahil Marikina started using rapid tests to screen our constituents. Nagkaroon kami ng rapid testing ng mga essential workers. Actually, nag-screen kami mga workplaces. So among the workplaces we screened were the barangays. So in-screen namin yung barangay workers, then yung mga tricycle drivers prior to the lifting of the ECQ, yung mga shoemakers, kasi ito yung aming industry dito sa shoemaking, so marami kami shoemakers. The City Hall employees, public markets namin, then currently nag-screen kami ng UB Express drivers and operators among others. So ang policy kasi namin, pagka nagkaroon kami ng rapid testing, pag may nakita kami positive doon, immediately sinaswab namin yon. So within the day, yung na-rapid test na nag-positive doon, dadalhin dito sa facility ito, then isaswab siya. Then after swabbing, ika-quarantine na uli siya dito sa hotel na to hanggang lumabas yung kanyang result. Kung negative, i-release na siya. Then kung positive, dito natin papasukan yung ating emergency quarantine facility. Last May 4 this year, nabuksan yung aming emergency quarantine facility. So ito yung aming sumunod na initiative. No? This facility was a collaboration between the AFP and WTA Architecture and Design Studio. No? So yung group na yun kasi, may mga previous projects na yan. Then napili nilang Marikina as one of their beneficiaries. So dito nila tinayo yung kanilang 310 facility. 310 facility na ito was done under the supervision of the City Engineering Office. Ang Marikina ang nag-provide ng location. Meron kaming MOA with Amang Rodriguez. Makita sa picture niyo yung director, si Dr. Mateo. So sila ang bahala sa operations nung tent. Kami lang ang nag-facilitate ng construction. The MOA indicates that the location and the funds for the construction of the EQF is provided for by the government, while the operations and maintenance of the EQF is handled by Amang Rodriguez Medical Center. Ito yung itsura ng EQF. Nasa likod lang siya ng Amang Rodriguez, which is extension lang siya ng hospital. Then makita natin yung mga partitions. Ward type siya, may separate partitions yung ating mga beds. Ang isang tent is capable of holding 20 patients, tapos meron tayong 3 tents. Yung unang tent ay gamit natin sa mga patients who are asymptomatic. The second tent is for mild symptomatic patients. And the third, sa mga confirmed positive na may mga morbidities like pulmonary TB. During the construction of this facility, nagkaroon din tayo ng konting challenges. Dito, pinakita ko lang sa inyo kung ano yung mga hinihinging recommendation ng DOH para mabigyan kami ng accreditation for PhilHealth. So among these are yung kailangan merong MOA, then kailangan niya strict compliance sa DM 2020-0170, kailangan niya exhaust fans, kailangan nga yung may plastic strip curtains, yung mga ganon, saka dapat nagkaroon ng perimeter fence. At the moment, the city has fully complied with all the recommendations and is just waiting for the accreditation papers. Yun yung kwento ng Marikina. No? From the start of pandemic hanggang dumating sa point kung bakit namin kailangan ng isang emergency quarantine facility. Then siguro later on kung may mga questions, doon kaya answer sa inyo kung ano yung mga ibang problems namin na-encounter dito. No? That is my presentation for today. Thank you for your attention. No?
Thank you so much po, Doc, sa pagbabahagi ng experience ng inyong city, Ang susunod po natin naman na presentation ay mula naman po sa experience ng isa pang city dito sa Metro Manila, sa Malabon City, nakapag-establish din po ng kanilang quarantine facility or ng kanilang treatment facility. Susunod natin po na presentation ay mula kay Architect Jose Miranda, chairperson po ng United Architects of the Philippines, Emergency Architects. So I turn over to you, Sir Jo.
Thank you, Anshe. Magandang hapon po sa ating lahat. Ang pinagmumulan po ng solusyon na aming nai-recommend para sa Ligtas COVID Center, Temporary Community Quarantine Facility sa Malabon ay actually ay doon na rin po nagmumula sa Malabon kung saan nagkaroon ng emergency about 2 years ago. Karoon ng sunog at kami naman ay dali-daling gumawa ng solution para sa isang evacuation. We were able to come up with the idea of using covered spaces like basketball courts, no, barangay centers, organize the area so that it could, house for the required time yung ating mga evacuees with some comfort, dignity in spaces. Next slide will show you the condition of the evacuees, no, as soon as they were transferred to the covered spaces. So pasok lang sila dito, they were processed, pero kung sino na una, they occupy spaces, bringing with them their things, no. Next slide will also show you as soon as they settle during the first day, they need to rest, they need to occupy spaces to sleep. We came up with the idea of using materials that are easily they are available, easily procured from the hardware, materials that strong enough, economical, durable, and the materials that you could use again and again. No? Yeah, first we tried to organize the space. If you have a basketball court, we could probably divide it into units of cells to contain sleeping quarters, no, for one family. So it's about, ang module namin is about 6 by 8 feet to contain a family of 5 or even 6 siguro, no. We tested this material. So that is one space that is 6 by 8 feet. We tried testing it if it would be stable enough, rigid enough, easy to assemble, and we find that it is possible to use it. We can pilot it in this emergency facility. We think together with the partners Accord, we think it is possible to teach, to allow users themselves, because of certain experiences before in emergencies, like in Tacloban, much of the rehab work there that are successful involved community involvement. No, they're part of the planning and they're even part of the deployment, the construction. This is a kind of an experiment, but it proved to be worthwhile. Next slide will show you structures already erected, no, at the site already, no. The earlier slide that I showed you was a testing sa aming shop. This one is now erected dun sa location sa Malabon. This is the completed emergency facility for evacuation. We estimate that for 30 days na nandito sila, it would provide them some refuge, some comfort. And true enough, may mga maganda namang comment na narinig kami that they were able to really rest, use the facility for their katulog naman sila ng maayos for the first time that it was organized. So this system looks promising, so that because as soon as it is the period of housing them there temporarily was completed, we collected and we stored these materials, and in fact they were able to use it again. Unfortunately, there was another fire. I think that was Nabotas. The system seems to be efficient by way of being redeployed again and again. Maliit yung per capita cost niya, so that it is very efficient to be used by LGUs. It is efficient to be used by LGUs because it's very economical. That is how it looked like. They were using this already for a few weeks and they seem to have adjusted to the living spaces. Yung pagpa-partition, we leave it to them. We erected the framing, and then they want to provide for partition, it's up to them. Sometimes kasi magkakasama sila doon, magkaka-neighbors and relatives, so they don't need any partition. But they can use their own, their own blankets, mats, and cheap plastics to set up to hang like curtain partitions. So this works, this sort of partitioning works, and now we recommended it to be used as the material, no, for the temporary quarantine facility, converting the Malabon Amphitheater into a COVID Ligtas Center. This is the area of the amphitheater that is to be converted, no, into a COVID center facility. We realized right away that the location really has a lot of positive attributes. Like, for example, of course, it is the proximity to the hospital ng Malabon, no, for management. Can we go back to the previous slide, please? There is some distance. There's about 17 to 18 meters, no, from the nearest habitable building. It stands in the middle of an open space so that we could treat areas in between as large buffer spaces. That's about good 18 meters, no, from the hospital Malabon. You have to walk a few strides going to the amphitheater. It is accessible, and there is drainage, there is sewage lines. There is already an existing toilet wash facilities that we only have to augment in order for the facility to conform with the requirements of DOH. No, there is a large buffer space here which I will highlight later on, which is very, very functional. This is now, if we could just enlarge this. This is the plan. After study and applying the recommendations, the guidelines for DOH, we started with the Memorandum 002 on conversion of public spaces. We saw to it that it adhered to the policies in IPC, dividing the areas into zones. So that the green area here is the sterilized zone where the staff is. The donning area, you go out to the suspect and probable cases. We follow the unidirectional flow so that when you go out, you pass to this hallway and then to the next hallway and then to the next. And then this is now the last block here is a separate block for confirmed cases. You go out and you have at the end the doffing area with wash basin and shower stalls so that you could go out of this area now clean. Basically, that's the plan. But I would like to point out another good attribute of this facility. This here on the right side is the sports center, and there's a good 18 meters there. So what we did is to provide a wall here, a plastic wall about more than 2 meters high. In the future, if we need to provide exhaust, because we are recommending that pero kulang lang sa budget ngayon, if needed, we could install exhaust here so that we could throw out stale air, even contaminated air on this space here, which is inaccessible, no, to anyone. It has a wall. So that's basically the plan which we implemented. This is about the third day of the construction. Next slide, please. That is the facility nearing its completion. This is the confirmed cases block. It's sort of a bird's eye view of the whole facility from the stage area. Testing of the lights. We have annunciators, no, for a few cubicles, no, as recommended by the medical officers of the LGU. This is a ramp as per recommendation of directors in Hospital ng Malabon. This stage here contains a block for 5 female suspect cases, and then that's where they assigned this block now for pregnant patients, and we need to install this ramp. That's a view of the shower room. It's just easy to clean tarp and a well-sealed floor drain that goes out directly to the drainage area. It goes straight into the drainage area safely. So that's it, basically, the layout. Thank you very much. If there's any question, I'd be happy to answer. Thank you very much, Anshi.
Thank you, Architect Joe, for sharing yung design ng facility sa Malabon. To complete the story po of Malabon City, to add on to the story of Malabon City, ang susunod naman po natin na presenter mula sa Malabon DRRM Office. So siya rin po ngayon ang current na COVID-19 Operations Coordinator ng Malabon DRRM Office. So tawagin po natin si Sir Arnel Mendoza.
Hello ma'am, Ante. It's nice to see you again. On behalf of Malabon LGU, binabati ko po kayo ulit ng magandang hapon. About po sa aking share is about Malabon City Community Quarantine Facilities. Share ko po yung about sa Malabon City Community Quarantine Facilities na ginawa sa aming syudad. Una po, syempre yung consultant and coordination with barangays and community to identify COVID-prone areas. Ocular to off-target site for establishment of CQF. Syempre, implisan talaga ang need assessment kay identification of existing wash facilities, determine of site vulnerability to hazard. Unang-una po yan, importante po yan kung ano naman po yung mga hazard tumama dun sa site, mapabaha or malakas na hangin. And then availability and potential capacity of site. Yung capacity like yung mga may CR po. mga ganyan yung site po natin. At syempre po yung ilan yung kasya dun sa area na pagtatayuan ng ating CQF. Proximity on site to service and other facilities. Syempre po, importante po ito, malapit po ito sa area ng aming City Hall. Walkthrough lang po ito. And syempre sa tabi po lang siya ng OSMAL, Hospital ng Malabon. At syempre may mga ambulansya rin po. Coordination meetings with the local interagency task force. Importante po yan syempre. Dito po kami kumukuha ng idea sa ating mga local interagency task force. Local DRR mechanism. Siyempre po, bago namin ito sinimulan, ito na po yung mga bago na ginagawa namin dati bago pa man mag-COVID sa aming DRM office. Nagkakanda kami ng mga risk assessments, mapping on site location, siyempre po, and then IEC, text blast, social media advisory, distribution and dissemination of risk communication materials, and then strategic planning including formation of a local task force and formulation of IAP o Incident Action Plan, and also the regular meeting of local task force meetings. Weekly po yan. Nakakatulong at inai-apply natin ang mga ito sa pagtatayo natin ng CQF po. Ito po yung isa sa mga nakakatulong sa amin sa pagtatayo ng CQF. Yan. Ito na yung pinaka-critical, siyempre, sa planning, sa implementation. Unang-una po, formation of TWG for CQF implementation. Dito po yung DRMO kung saan kami po yung lead sa logistics. Then engineering for the actual construction. Health office for design and consultant. And also GSD o General Services Department for site sanitation. Design consultants with UAP. Siyempre sila po yung yung design workshop with the UAP based dun sa LGU na LGU yung sa amin, yung needs and capacity po namin. Planning meetings online and on-site to refine site plan, wash plan, and consideration of IPC and implementation. Nagko-consider kami ng tatlong site bago mapag-deploy sa Malabon. Ito po yung pinag-usyan namin yung Malabon National High School, ATS. Yan po yung mga site na pinuntahan namin pero ang bagsak pa rin po namin is dun sa amphitheater dahil nga yung site po maganda po at talagang availability yung mga hinahanap natin. Siyempre yung wash plane critical sa pandemic response, kailangan po yan. May mga datos din po na dapat i-consider sa planning gaya ng mga COVID cases. Siyempre po sa Malabon po tumataas po yung cases namin, and siyempre po household data on target CQF site, siyempre available spaces for CQF and LGU protocols. And also risk communication and community engagement. Siyempre, City Ordinance on Anti-Discrimination to address the stigma. Siyempre po, isa po yun. And then official announcement and feedback mechanism. Nagbibigay po kami ng mga hotlines for COVID-19 reports. IEC, social media posts, adherence to Data Privacy Act, and BERTS, katuwang po namin, yung Barangay Health Emergency Response Team. And also develop of materials for the CQF. Yung po yung sa loob, mga signages, maps, announcement on what is CQF. Siyempre dito tayo sa gaps, challenges, and opportunities. Ito po yung talaga isa sa pinakahamon sa paggawa ng CQF. Unang-una po yung availability of materials, siyempre in pandemic situation. Alam naman po natin na hindi normal yung situation natin at dahil may pandemic po. Nagmula po tayo sa ECQ, may mga delay sa mga materials. Isa po yun sa mga problema namin. May mga demand for hospital facilities na need din po. Based po sa aking experience, yung mga ginagamit po sa CQF is nakikita ko pong ginagamit din sa mga malls. Like yung mga simple microtape, white plastic covers. Kaya siguro po dun din mismo kami nagkaroon ng problema sa pagbili ng mga materyales. And also syempre po yung mga lockdown dahil naantala yung mga delivery ng materyales sa mga hardware. Developing studies of COVID affecting availability of guidelines, facility, standards, and health protocols. Evolving pa rin po yung yung COVID pandemic, alam po natin, pinag-aaralan, inaaral pa rin natin, inaaral pa rin ng mga scientifico. Tsaka po yung guidelines, may mga bagong guidelines na ibinababa sa LGU. COVID testing of CQF ground team and workers before and after deployment. Isa rin po sa challenges namin yung isa sa mga workers namin, rapid testing namin, nag-positive po siya. So, nag-start na po yung paggagawa. So, naantala po kami almost 2 days. So, challenge po yan. Siyempre po, yung tao po na nanggaling sa ECQ ay gusto po talaga magkaroon ng trabaho. Siyempre, isa po siyang skill worker na gusto namin magkaroon na, yun nga po, matulungan. But, nag-rapid test po at nag-positive po siya. So, naantala po kami ng 2 days. Kaya, yun po yung sa mga challenges namin. Siyempre, gusto rin po namin matulungan from the ECQ yung mga workers. At siyempre, yung safety po ng bawat isa, antala kami ng 2 days. Kahit sino naman po na LGU tapos nag-positive, kakabahan talaga eh. Mararamdaman niyo, syempre may pamilya tayong inuwian. Yun po, isa po yun sa challenges natin. Hindi mawawala talaga yun. And then, the available ATS model translate into ito na po yung sa opportunities Available ATS model translate into the CQF design that are replicable by LGUs and communities. ATS po models, pwede pong i-replica at kayang gawin ng mga anumang LGUs dahil nga po gawa po ito sa plastic pipe and also the communities with the minimum technical support. Kaya po. And then, good enough facility functionality to respond to urgent needs while still available for future improvements. Gusto pa namin pagandahin. Marami pang pwedeng pagandahin yung facilities na tinayo namin sa CQF. But kapos na sa oras. Siyempre po, masyadong lumolobo yung cases namin. Need na po talagang magamit. Within, yun nga, 14 days po yung binigay sa amin para matapos po ito at para magamit ng mga pasyente. Close coordination and established relation among stakeholders facilities implementation. Sabi nga po, hindi naman po talaga kaya ng isa to. Alam naman po natin na yung mga LGUs ay may kanya-kanya rin pong ginagawa. Kailangan po talaga tulungan ng lahat, hindi lang ng city, government, ng ating CSU, partners, etc. Kailangan magtulungan po tayo dahil lahat po makakaya natin basta sama-sama. Muli po, marami po salamat.
Para po makumpleto ang ating roster of speakers ngayong hapon, i-welcome po natin si Dr. Mitzi Tanchoco Yongson. Siya po ang Chief of Hospital ng Ospital ng Malabon. So yun po, i-welcome po natin si Doc at i-turn over ko na po sa inyo, Doc.
Yes po. Okay. With regards to the CQF updates namin dito sa amphitheater, I would just like to give the background. When this was offered to us by Accord, we were so elated kasi po the city is having a problem with regards to the isolation area of the hospital. We were able to put up improvised tents just so to accommodate yung mga pasyente po natin na probable, moderate, to severe cases ng COVID. But since we are a level 1 hospital, we have to transfer confirmed cases, the moderate to severe confirmed cases, to DOH accredited hospitals. But syempre po, habang naghihintay po tayo ng results from selected testing centers, medyo it takes time before we could transfer patients. So we have to accommodate these said patients and give hospital management. Fortunately, Accord came in together with UAP, and so with open arms, na-welcome po. At nagpapasalamat po kami sa mga tumulong po sa amin dahil from isolation facility of the community, the amphitheater was then transformed into isolation area of the hospital. At present, we have furnishings like beds, tables, trash bins na po na na-deploy sa LGU with all the requirements being given by DOH just so they could certify the availability of the space. Swerte naman po tayo dahil nung tinurn over po ito sa atin ng ating partners ay last June 18, the day after, DOH came in to inspect. Medyo may konti lang pong requests at saka medyo kailangan lang po idagdag. But again, we are very thankful because we were accommodated by our sponsors. From June 18 na turn over po sa amin, June 19 inspection of DOH, June 20 coordination with Accord and Engineering Department of the city, and June 21 natapos po lahat-lahat ng mga requirements ng DOH, and present po na-accommodate na po namin ang aming pasyente. We were able to cater 7 probable cases of COVID and 2 confirmed cases that we need to transfer to Tala. Sa amin pong setup, as previously mentioned, we were able to isolate and designate the patients from female to male probable cases, and of course, from probable to confirmed. And with availability of the stage at the amphitheater, we will be able to accommodate naman po yung mga buntis. We will be doing the delivery of probable or confirmed COVID cases po na pregnant para naman po hindi din makontaminate yung aming ospital. We are so sad that the hospital cannot accommodate these COVID cases. Kaya po, nung dumating naman kayo, sobrang masaya naman po kami dahil with open arms, nakuha po namin i-accommodate lahat na ng pasyente ng Malabon. So with that po, maraming salamat po sa inyong lahat.
Thank you po, Doc Mitzi. No? So yan po yung ating 4 presentations for this afternoon. We started off with the policies and guidelines from the Department of Health, followed by the sharing from City of Marikina kung saan nakita naman po natin ano yung process pinagdaanan nila at pasimula doon sa pag-identify ng mga isolation units, paano nangyayari yung rapid testing, yung swab testing, at hanggang doon sa pagtatayo po nila ng mga treatment facilities at ano yung mga ongoing ba na initiatives ng Marikina. And for the last set of presentation naman po, nakita natin na dito sa Malabon City, mayroong need to establish a facility that would cater to probable suspect and positive patients at kumbaga ginamit ng city yung kanilang existing na ERR capacities para matweak yun, ma-convert iyon into something that is relevant to the current needs in terms of COVID. At doon po sa both presentations ng Malabon and Marikina, nakita natin yung very strong na partnership among yung different offices ng local government. So, City Health, City DRRMO, engineering, mga iba't iba pang opisina, at yung mga partners din na national government agencies, kasama po ang Department of Health, mga ibang private institutions, mga technical professional organizations, kagaya ng emergency architects. So, nakita po natin na isa siyang joint effort. It's a collaborative way of operating at yon naghanap ng solutions batay sa need at batay doon sa existing na capacities and limitations din ng ating nitong mga cities at ng mga communities po na ito. Ngayon po, mayroon tayong mga questions na pumasok. We will try to address all the questions. Let me start off to sa una nating tanong. Ito po ay address para kay Dr. Guevara of Marikina City. Ang tanong po, Doc, is the Marikina City Monitoring System Program locally developed? And ito daw po ba ay maaaring i-share yung program nyo na ito sa ibang local government unit?
Yes, yung aming monitoring system was locally developed. No? So sinimulan ito nung office namin, yung SESU. Nag-coordinate kami doon sa Marikina Management Information Systems and Call Center, yung MISCC section. Yung MISCC namin kasi meron kaming mga ITs doon. Kinausap namin yung IT, tinanong namin kung kaya niyang gumawa ng isang system na ibinase namin doon sa CIF ng DOH. Yung CIF kasi napansin namin pagka gumagawa kami noon, pagdating sa lab, usually hindi bumabalik sa amin yung CIF. So sabi namin, gusto namin sana may copy kami pero kung maaari, reproducible na. So na-develop yung program. Then eventually, humingi kami ng tulong sa aming mayor's office. Nag-collaborate ng ibang offices like yung PIO, yung Public Information Office. Na-develop yung aming application which is up to now, dinidevelop pa namin kasi habang ginagamit namin, nakikita namin yung mga kinks, yung mga problems. So dahil locally developed, madali namin siyang i-correct. Then, in relation do sa pangalawang tanong kasi, may nagtanong dito kung in-overlay po ba namin yung spot map ng COVID-19 sa Disaster Risk Management Spot Maps. Actually, nakita yung map kanina ron na part ng aming system ay galing din sa MISCC. Meron kaming generic na satellite map na ginagamit ng aming disaster management din. Yun yung ginagamit namin. In-overlay lang namin kung nasan yung mga confirmed cases, nilalabas doon sa map na yon yung mga residences nila. So yun, ngayon, kung gusto ba namin i-share, personally, yes, I would like it to share the system. Pero syempre, dahil city-owned to, maraming nag-develop, itatanong ko kung amenable sila na i-share. Pero sa akin, personally, yes. Bakit hindi? Kung makakatulong naman sa lahat, lalo na padali yung trabaho natin, magandang i-share to.
Thank you so much po, Doc. We understand na yun. Siyempre, kailangan mapag-agrihan kung paano ma-share. At siyempre, dapat meron ding, kumbaga, explanation na itong system na na-create ng Marikina ay nag-work doon sa context ng Marikina. For that, we will take note na siguro po, sir, later pwede din nating i-discuss kung mag-decide po yung inyong LGU na pwede itong i-share sa iba pang partners. Then we'll keep in touch para kami naman po ay patuloy na makatulong sa ating government sa iba't iba't ibang stakeholders dun po sa pag-disseminate pa ng mga good practices na nag-i-exist sa atin pong mga LGUs. Thank you po. Ang susunod po natin na katanungan ay related naman sa waste management. Pwede ko po sigurong i-request si Doc Mitzi dito po. Paano po yung nagiging waste management dito sa ating mga health facilities for COVID patients?
With regards to the waste management, we have our infection control nurse and also our pollution control officer para i-monitor yung ating waste. And then we have our partner who takes the waste.
Thank you po, ma'am. Baka po meron ding additional input po from Doc Guevara naman kung ano po yung mga practices or ibang mga practical tips po ninyo on waste management para dito sa mga facilities na nagkikater sa ating patients.
Sa waste management, meron kaming daily collection ng hazardous waste. Kasi part ng aming SEMO, yung City Environment Management Office, meron silang special trip para lang sa mga hazardous waste. Dinadaanan din nila lahat ng mga confirmed cases. Kasi at the end of the day, lahat ng aming confirmed cases, meron din silang nare-receive na report yung SEMO. Then alam nila kung aling mga bahay yung merong mga positive cases. Dinadaanan nila yun everyday. Meron mga yellow trash bags na kanilang ikinokolekta. Tapos meron kaming central collection na area na kung saan yung aming accredited sa waste disposal namin, nagkakaroon ng collection po ng meron naman sila schedule. Ganun yung sa amin.
Okay po. Tapos sir, ito pong maganda na share nyo yung may system ng pag-collect ng waste kasi identified kung saan nanggagaling yung mga hazardous waste. Sir, paano po yung nagiging disposal nitong mga ganitong tipo ng hazardous waste?
Sa amin kasi merong accredited na nagdi-dispose din. Kino-collect lang namin tapos nilalagay sa isang storage area. Then kino-collect yun ng accredited na company.
May nabanggit si Doc na isa pang mahalagang actor, no? Ito pong mga city or municipal environment offices na kakatulong din natin sa ganito to ensure na maayos yung ating mga waste disposal. Maraming salamat po doon. Ang susunod naman po natin na tanong for Architect Joe. Ang next po, Architect Joe na tanong, how was the original design intended for a fire hazard contextualized for COVID? And how was DOH and other health stakeholders involved in the design and implementation of the facility?
Well, una, there is a guide, the policies and regulations, guidelines regarding to the conversion of facilities into COVID centers ay available from the DOH. They have enough information and guidelines. Nakatulong din yung galing sa WHO. Nakakuha kami ng information. Although somehow there are changes along the way actually. I think we feel and we think that we were able to satisfactorily conform to the guidelines. But of course, we were waiting for some, not exactly validation from the DOH, but some commentaries, no? So we submitted the plans to DOH National, and we were instructed to forward our plans to the specific region where the center is going to be constructed. So we forwarded it now to DOH NCR. Doon lang, may konting gap talaga doon because we were waiting for their reaction. We understand that DOH during those times were really very, very busy. We waited for more than 1 week and then luckily enough, there was response. I remember Dr. Bellarmino contacting me upon instruction of Dr. Corazon Flores, the NCR director. And we were able to get their feedback. Once we got their comments, we work on it right away. And then timing naman, natatapos na rin ang coordination ng partners sa LGU Malabon. And immediately we were able to meet para i-contextualize into the local needs and requirements ng COVID center with the local officials, especially the medical officers ng Malabon. Now, what was the other? Right from the start, I think Accord was already calling on stakeholders. Merong agad initially 2 private consultants na pinakilala nyo sa amin at right at that moment, nabigyan agad kami ng mga tips, especially on IPC. Well, no-brainer kasi yung the use of these materials, PVC and TARP. So si TARP, pag sinindihan mo yung TARP, masusunog yon. It's just a measure, calculate ang risk, For a COVID center, we believe that malayo ang risk ng fire because we're not using any open flame doon. We laid out the electricals in a manner that they are really separate. They're at a safe distance dun sa flammable parts ng cubicles. I think it is safe enough in case of kung fire safety ang pag-uusapan. But of course, ang Bureau of Fire Protection, meron silang pine-prescribe na mga, equipment, no, that you should carry. So maybe ang standard equipment niyan, yung for a number of rooms, meron silang pine-prescribe na fire extinguishers that it should be handy just in case of any emergency. Maybe yun ang isang magandang i-implement dito sa COVID center. Maglagay tayo nung 5-pounder na fire extinguishers.
Thank you po, Architect Jo. Siguro po just to add, yun pong mga original na designs ng shelter, they were originally really intended for them to be flexible enough. So ito po ay mga modular, madaling mag-iba yung configuration and they can serve different purposes. Same po yung system nung framing, noong walling, nagkaroon po ng tweaks in terms of designing, ay mas doon na po sa layout na share din kanina ni Architect Jo na of course following yun pong ating DOH guidelines na siya ay unidirectional, paano yung pag-apportion ng space for different uses doon sa ating facility. Yun po. For more information po on these ATS designs, we have materials and other information din po on the Real Hub website. Ang isa pong tanong naman para naman po sa ating mga kasama from the Department of Health. Ito po, Doc Antonio.
Yes po.
Yes po. Sir, ito po yung isa pong tanong natin. A lot of our participants are also in need or are also planning to put up mga isolation or quarantine facilities for returning residents. Both yun pong ating mga locally stranded individuals and yung mga repatriated din na mga OFW. Sir, meron po bang guidelines na specific for this particular purpose?
I think I'll just get this from the experience of other provinces po, no. These temporary treatment monitoring facilities are also being used as quarantine facilities for yung mga returning from NCR going to provinces. In terms of infrastructure, ganun lang din naman po yung kailangan. Yun po.
Okay
In terms of guidelines naman, sa mga repatriates po, no, so it's a different population. We have the Department Memorandum Number 2020-200 or the Omnibus Guidelines for Quarantine and Isolation Procedures for all arriving overseas Filipinos. Yan po.
Thank you, sir. No? So, meron tayong specific guidelines for arriving OFWs. And then, para naman dun sa mga facilities for locally stranded individuals at yung iba pa na kailangang i-quarantine ay mag-a-apply yung same na guidelines and standards related pa rin dun sa management at saka dun sa safety at syempre yung mga infection prevention and control mechanisms. Yun po. Ang next po na ating question, I would like to request po si Sir Arnel from the Malabon City LGU. Ang isang tanong po dito ay, ano po, sir, yung mga iba't ibang grupo na na-involve doon sa ating community information dissemination at pagbubuo ng mga health messaging? So, yun po, Sir Arnel.
Okay po. Yung mga nabubuo po, nakatulong po sa atin, like yung mga fire brigade volunteers natin, and also our BFP, and also yung local HOA or Homeowners Association officers para po sa kanilang community. May baba po. Yun lamang po, ma'am. Thank you.
Salamat po, Sir Arnel. Ayan yung isang nakita din natin na mahalagang-mahalaga. Yung information dissemination, yung risk communication and community engagement para yung communities, yung general public ay nauunawaan nila ano ba yung mga measures na sinasagawa to manage itong ating situation, including yung pag-set up ng mga health facilities para maiwasan, para masolusyonan yung stigma at para mas mapataas yung kaalaman din ng ating general public. Meron pa po tayong ibang mga pending questions but kailangan na din po nating mag-wrap up. So, doon po sa mga inyong mga tanong na hindi po natin nasagot ngayon, ay pinaabot na rin po natin ito sa ating iba't ibang speakers at we will try our best para po masagot ito pa inyong mga tanong at isasama na lang po natin doon sa ating documentation na ipopost po natin sa ating Real Hub website. Pasensya na po, medyo mukhang madami, madami talagang kailangang i-discuss related to these facilities. Para po tayo makapag-proceed, magre-request po sana kami ng isang reactor natin mula dito sa ating mga nakasama ngayong hapon kung ano po ang kanilang feedback dito sa discussion na nangyari sa atin ngayong hapon. For this, we would like to request Ian Ceciliano. Siya po ang MDRR officer ng Libon Albay. Thank you po for joining and I will turn over to you na po.
So, good afternoon, everyone. I'm Ian from Libon, Albay. So, while given the discussion we had today, I think the LGUs in the province have different needs than those in Metro Manila. That's one thing I observed there. Kasi I attended this webinar because I believe we really need to improve our community quarantine facility. Kasi given the influx of locally stranded individuals due to the Balik Probinsya program, yung focus namin is more on the preventive aspect of management. Kasi right now, yung LGU namin is wala pa kaming case. Pero most likely magkakaroon. But we are trying our best not to have one. No? Pero yung isang pinaka-interesting na natutunan ko dito from this webinar would be the one done by Marikina MHO, yung pag-geotag ng location ng confirmed cases for contact tracing. Maganda talaga siyang gawin, and I will have to recommend this to our local task force and to our organization ng DRRMO sa Albay. Kasi maganda yun para mabilis nating ma-identify kung sino yung for contact tracing. And given yung interesting din yung gaps challenges na pinresent kanina ng Malabon City DRRMO, because definitely we can relate to that. Lalo yung kakulangan ng resources during the start of pandemic operations. No? Pero ngayon kasi is nagbabago na din yung needs. Right now nakafocus kami on the quarantining din talaga ng mga padating. Maganda din yung mga points na pinresent ng mga LGUs natin. And yung sa Marikina din, it's really interesting yung pag-establish nila ng molecular diagnostic laboratory. Sana magkaroon kami, pero definitely with our resources, we can't. Pero maganda talaga na magkaroon ng diagnostic laboratory. Siguro yun lamang yung geotagging talaga yung isa sa pinaka nag-catch ng attention ko, and I would really suggest this to our local task force and to our organization ng DRMOs sa Albay. Yun lamang po. Thank you for our speakers. Madami tayong natutunan today, and we have points for improvement in our own community quarantine facility. So thank you very much po for the new learning today. Thank you.
Thank you po, sir, no. Kahit na 'yon nabanggit niyo na may magkakaibang context, no, pero diyon may mga lessons, no, na we can learn from, and then we contextualize doon sa ating iba't ibang context. So, thank you po ulit, Sir Ian, for joining us today. Yes po, si Miss Kathleen Kissy. Go ahead, ma'am.
Salamat. This has been a really useful set of presentations for us. So I'm briefly lang, I'm with the Asia Foundation Agap Banta Group. So we're currently working on putting together a disaster preparedness guide amidst COVID-19. And we know that we're expecting also the incoming typhoon season. So that's why my questions were, how are we thinking about really contextualizing and being able to use this for other hazards that we are expecting in the coming months. That would be one of the main considerations, and something that I'd like to throw also to our resource persons today. Siguro isa lang yung na-pick up ko rin was the way in which the local government seems to be somewhat ahead of the game. I know that DOH has been putting the guidelines and all, and the context and protocols, but I see some disconnect between the adoption of some of the good practices that's coming out from the local governments and with how the national government is reacting to all of this. So I might be wrong in my perception, but that seems to be what's coming out here. But hindi klaro kung paano tinitignan ng national government itong mga innovations na nanggagaling sa ground, no? And then siguro second point of interest for me is how the different structures, kasi ang DOH has its HEMS, right? And the DRM offices also have their respective structures, contingency plans. So how are all these coming together, and what ties them in terms of being able to activate them effectively for these types of pandemic, for these types of emergencies? Those are my main thoughts. But from our end, this has been very, very useful. And siguro after this one, I'll be coordinating with CARE and the team also to invite you to share your good practices for the guide. And I'll keep you appraised on that, Anshe, and your team.
Thank you so much po, ma'am, for sharing your insights. Nabanggit niyo po yung how do we now deal with incoming emergencies, complex emergencies across the Philippines. So, meron tayong natural hazards. We have human-induced hazards throughout the Philippines. How do we now deal with the complex emergencies situation of pandemic? Thank you, ma'am, for mentioning that. Yun pong mga suggestions din from the participants doon sa ating registration. Isa din po yan doon sa mga talaga tumatak na tanong ng mga tao. What's next? Lalo na papasok na yung ating monsoon season, baha at mga bagyos. We will have more sessions similar to this, and yan po yung isa dun sa mga tinitingnan natin na mga susunod na topics. In terms naman po of harnessing or capturing experiences, mga practices, mga practical challenges, and how the LGUs were able to resolve this. So yun din po yung isang gap that Real Hub would like to be a part of filling, yung paano natin makikita yung mga very practical talaga na measures para dito sa sama-sama natin na pag-address nitong mga challenges natin under COVID-19. Yan po yung isa, kaya talagang ang gusto po natin ay makapag-organize ng mga sessions na mas nandun siya sa practical side para we would be really able to help our local government units, our communities, yung mga appropriate na practices na makakatulong din sa kanila. So thank you so much po, ma'am. So part din po of our session today ay mga ilang representatives po from the Fair Building Network, at sila po ay may mga iba't ibang initiatives din that support mga communities and local government unit na makasupport sa kanilang iba't ibang mga proyekto. So yun po, on this slide, nandito po yung kanilang Facebook page and Instagram page as well as their contact details. For those po na interested, you can check their social media site out, and we would also include in the documentation yun po yung kanilang contact details para po kung meron tayong mga naisip na kailangang establish na treatment, quarantine facilities, at iba pa, we can reach out to them to see kung ano po yung mga possible collaboration na pwede. Sige po. And also, as mentioned kanina, yun pong inyong mga materials, i-upload po natin doon sa Real Hub. At kung meron pa po kayong further questions or naghahanap po kayo ng mga partners that can help you in establishing community quarantine facilities, please feel free po to send us a message, and we will try our best to link you up with other agencies who may be of help. Maaring nandyan po sila geographically or nagmamatch yung kanilang program doon po sa inyong pangailangan so that we can help each other out. Ito po yung ating next na Resilience Knowledge Exchange Series, Session 2. Ito po ay COVID-19 NCR Rapid Gender Assessment Report. Ito pong session na ito would provide us with information about the different needs, capacities, and coping strategies of women, men, boys, and girls in a crisis. And ito pong Rapid Gender Assessment na isinagawa natin progressively built up using a range of primary and secondary information to understand the different gender roles and relations, and how strategies need to be in place to support the changing gender dynamics during a crisis. And to close our session for this afternoon, I would like to call Celso Dulce, the Integrated Risk Management Director of CARE Philippines.
Magandang hapon po. Hindi na tayo magtatagal. Gusto ko na lang magpasalamat sa mga resource speakers ngayong hapon na ito, kay Dr. Terence Antonio, kay Miss Joy Padrigano ng Department of Health, kay Dr. Christopher Guevara ng Marikina City Health, kay Arnold ng Malabon City DRMO, kumusta? Matagal na tayong hindi nagkikita. Kay Dr. Mitzi Tiongso ng Hospital ng Malabon, kay Architect Joe Miranda, matagal na rin tayong hindi nagkikita. Kumusta kayo? Maraming salamat sa inyong lahat, at nakakatuwa na batay doon sa feedback ay very informative yung ating hapon. Tinitingnan ko, meron tayong lagpas 140 na dumalo dito sa ating learning session. Matitibay na nagstay hanggang ngayon, mga 100. Maraming salamat. Mahirap na isa-isahin ang inyong mga pangalan, pero rest assured, well appreciated yung inyong participation. And lastly, gusto kong ulitin yung na-announce na ni Anshe na tuloy-tuloy itong atong mga learning sessions, knowledge sharing activities. Ang susunod nating pag-uusapan ay tungkol sa gender. Ano ang mga usaping gender sa panahon ng pandemic. Habang 'yun ang pinaplano natin, may nakasunod na ulit batayan sa na identify na urgent and important na nagawain na paghahanda. Ano ba ang paghahanda para sa padating na tag-ulan, tagbagyo, tagbaha, at may kakaibang aspetong kailangan nating konsidera, yung COVID-19 pandemic. Sa Mindanao nga, may dagdag pa at kahit sa iba pang areas ng Pilipinas, napakaraming kailangan nating i-consider. May natural hazards, may conflict, at saka pagkatapos may pandemic. So paano tayo gagalaw? Paano tayo mag-respond sa ganitong situation? Pero para sa akin, may mahalaga ding mensahe. At least ako may realization din na hindi tayo nag-uumpisa sa zero. Oo, ang pandemic ay hindi tayo familiar, pero hindi tayo zero sa kaalaman, hindi tayo zero sa mga sistema, at dapat nating minobilisa, ginagamit yung ating knowledge and systems on resilience building para maharap itong iba't ibang pagsubok na kasalukuyang naranasan natin at mga parating. Yan po, maraming salamat sa inyo lahat.
Thank you po, Sir Celso. Last slide na lang po, gusto rin naming i-share sa inyo at gusto naming magpasalamat sa iba't iba pong mga proyekto at mga organisasyon na tumulong sa atin para maisagawa itong ating webinar series. Ito pong ating session ngayon ay supported ng Move Up or Moving Urban Poor Communities Toward Resilience Project funded by the European Union Civil Protection and Humanitarian Aid. Kasama rin po natin ang Partners for Resilience at mayroon din po tayong initiatives with the funding support of the Czech Republic Humanitarian Aid. At syempre po, mula sa ating partners, CARE, Accord, ang Malabon City at United Architects of the Philippines Emergency Architects. At yun po, salamat po sa inyong support dito sa ating webinar series. Dito po nagtatapos. Huwag niyo pong kalimutang bisitahin ang ating realhub.org. Doon po tayo magkakaroon ng announcements kung kailan po natin ipopost yung atin pong documentation at yun pong iba pang mga materials. Meron po tayo palang concept paper tungkol dito sa community quarantine facilities at ipopost po natin iyon doon para po meron tayong reference. Feel free to drop us message kung meron po kayong katanungan or mga ibang information na gusto din po ninyong i-share sa amin. Maraming salamat po sa pagsama po ninyo sa amin sa session ngayong hapon.